With the rise in obesity rates, many are turning to weight loss medications as part of their journey toward better health. But with so many options available, how do doctors determine which medication is right for each patient?
Yeah, we spoke with Dr. Pranam Kokila-Kumar, who broke down the most commonly prescribed weight loss medications, their potential side effects, and how they fit into a broader treatment plan that includes diet and exercise. Dr. Pranam, thank you so much for joining us today.
Thank you again, guys. Appreciate it.
Thank you. Good to have you here. All right. So weight loss medications,
Yes.
the topic today. So can you provide an overview of the most commonly prescribed weight loss medications, and how do you determine which one might be appropriate for a patient based on their health profile?
Absolutely. So obviously we look at their medical history. We make sure that there are no red flags, no issues with their medical history that would be contraindicated in me prescribing, or any physician prescribing, a medication for that patient. So an example of weight loss medications, let's talk about one of the common ones that we prescribe is phentermine. Our brand name Adipex. It's one of the oldest medications. We typically prescribe it for about 3 months to get the patient going on a weight loss journey. Some physicians are comfortable prescribing it for longer periods of times, but we have to watch out because it's a stimulant. Make sure there's no elevated blood pressures, heart rate, so on and so forth.
Right.
Definitely not meant to be prescribed in individuals who have certain heart disease, lung disease, and so on and so forth. Then we've got medications like your GLP-1s. I mean, they're the new hot kid on the block.
Right.
So you've got your old school like Victoza to the newer kids like Trulicity, Ozempic, and Mounjaro. Ozempic's counterpart is Wegovy, and Mounjaro is Zepbound. So yeah, we make sure that there are no certain thyroid dysfunctions, pancreas issues, certain abdominal issues like gastroparesis to prevent us from prescribing the medication and then exacerbating a negative side effect that could have been avoided altogether. Let's see, what else do we do? Metformin is another common one. It's a diabetic medication that can help regulate glucose levels a little bit better, can also help improve insulin sensitivity, but you don't want to prescribe it for individuals who already have bowel irritation or certain degrees of kidney disease. So Natalia, there's a whole
There's a lot of
slew.
them,
Oh,
yes.
absolutely.
Yeah.
Do you guys have to have like 30 minutes to go through the whole list? I mean,
Because there is that much. And here's the thing, every medication that you just mentioned, and this is what we're talking about now, side effects. I think everybody out there has seen those commercials, and usually the list of side effects is longer than half of the length of the commercial.
Exactly.
Oh, yes.
Yes. Yeah.
Yes.
So how do you actually assess those risks and the benefits of those medications per patient?
So open communication. I try to be as open with the patients as possible with whatever medication they decide to pursue. Let them know, hey, this is your side effect or risk profile. These are the potential benefits. We don't know how it's going to affect you unless you actually take the medication. Is this something you're interested in taking? They'll tell me yes, no, or, let's try something else. Right. And we just go from there. So I really think it's about developing that patient-physician trust, and then once that trust is in place, we just go from there.
Okay, so now how do you integrate weight loss medications into an overall treatment plan? So, and how do you emphasize lifestyle changes, right? Because it's most important, like diet and exercise in conjunction with this medication use.
So the lifestyle changes are the big cornerstone. The medications may work, but without those lifestyle modifications, you're going to hit your plateau a lot sooner than you would if you did the modifications in conjunction to it. And unfortunately, I do have a number of patients who, due to either circumstances or choices, that they've hit the max dose of whatever medication that they're on, and they're not able to lose any additional weight because of said lifestyle changes not being made consistently. And I understand, it's life, it is what it is, but in order to get to the goal, sacrifices have to be made, right?
Exactly.
Yeah. And I guess you can be typical of plateauing with some of these as well.
Oh, absolutely. So a lot of individuals who have been on Ozempic right now are on the max dose as long as their body can tolerate it. And what we're also seeing right now, which is a bit interesting, and the literature hasn't proven this just yet, is that some of the weight is starting to creep back up, almost as though the body is developing a tolerance to the medication. So that's something that we also see with other medications in the past, the body has a way to adapt around it and develops a tolerance to it.
Talk to us about the appetite suppressants. You've got metabolic enhancers. A lot of people could be using those for other types of weight loss medications. How do these impact the patient's just the health and overall ability to lose weight?
Sure. So here's the thing with these metabolic enhancers. They're typically sold under the guise of a supplement that's supposed to revamp your metabolism. Either it's a single ingredient or a concoction of different ingredients blended in together that's supposed to take your metabolism to the next level. And unfortunately, none of the literature has really shown that. Coffee and green tea extract in certain amounts can help boost your metabolism, but not to the way that social media would make you believe. So you actually would be better off doing resistance training and actually getting better quality sleep to optimize your metabolism. And if you just course correct for those two, people's metabolisms significantly improved back to what their baseline should be than if they get poor non-restorative sleep or are very sedentary and don't move a lot or lift heavy weights, so on and so forth.
Okay. All right.
That's tough.
Good luck.
Yeah, basic thing, move, right?
Move, eat well, rest, and enjoy the journey.
And listen to your
right.
body, all right?
Yes,
Big
yes.
one on that too. Doc, appreciate it.
Thank
so
you.
much.
No, thank you for bringing me back.